Chapter 13: Medicine, Health and Bioethics. To truly know another's truth, you must have walked their path. Medicine is more than the science of healing, it is the moral mirror of humanity. It reflects who we are, what we value, and how far we are willing to go in the name of progress. For centuries, it has evolved from superstition to science, saving lives and extending human potential. Yet beneath every breakthrough lies an ethical question. Who deserves care? Who decides the limits of treatment? And what does it mean to heal in a world where profit often outweighs compassion? Modern medicine's power is matched only by its complexity. Pharmaceutical companies wield enormous influence over public health, yet too often conceal the full truth behind their findings. Full disclosure of all clinical trial data, including negative results, must become both a legal requirement and a moral duty. Transparency, supported by clear explanations, strengthens trust and prevents misinformation. Just as food products must display their ingredients, medicines should clearly present evidence of their development, benefits, and risks. Truth is not a threat to science, it is its foundation. Addiction reveals the moral dimension of care. Drug abuse is not simply a failure of willpower but a symptom of deeper pain. It begins with choice but soon becomes compulsion, driven by trauma, genetics, and environment. Treating addiction as crime instead of illness perpetuates suffering. Compassion, therapy, and education, not punishment, are the true antidotes. To heal addiction, society must heal its own misconceptions. The same moral clarity must guide our approach to cannabis. Once demonized, now increasingly vindicated by science, it shows measurable benefits in managing chronic pain, epilepsy, PTSD, and chemotherapy-related nausea. Its legalization for medical use is not an act of rebellion but of reason. If alcohol and tobacco, far deadlier substances, are accepted, then denying safe, regulated access to medical cannabis exposes hypocrisy more than morality. Mental health remains another vital frontier. Conditions like depression, anxiety, ADHD, and personality disorders are real medical issues, not weaknesses or excuses. The brain can suffer as profoundly as the body, yet stigma persists. Too many people are taught to endure rather than express pain. Psychiatric diagnoses, though imperfect, provide a framework for understanding. Used with empathy and accuracy, they empower both patients and professionals. Mental health care must stand equal to physical health care because invisible wounds can be just as fatal as visible ones. In sport, that equality must also apply. Mental health breaks should be as normalized as recovery from physical injury. An athlete's mind deserves the same respect as their body. Protecting mental well-being is not weakness, it is wisdom. As technology reshapes medicine, ethical restraint is more important than ever. Genetic engineering and cloning offer astonishing possibilities, from curing disease to growing transplant organs, but they also challenge the boundaries of morality. Editing DNA to prevent suffering may be justified, but designing traits like intelligence or beauty risks turning children into commodities. Human diversity is our greatest strength. Perfection through manipulation would erode it. The same applies to animals. If modification saves lives, it must be done without cruelty or exploitation. Science without compassion becomes tyranny. Euthanasia, one of the most sensitive debates of all, demands honesty. For those enduring unbearable, irreversible suffering, the right to choose a peaceful end should be recognized under strict ethical and medical safeguards. Dignity in death is not defeat, it is autonomy and mercy at life's final threshold. Ultimately, medicine must never lose sight of its humanity. Transparency, compassion, and accountability should guide every institution, from pharmaceutical companies to hospitals and governments. Health is not a commodity, it is a universal right. True progress lies not only in technology but in trust, in ensuring that knowledge serves life rather than power. The future of medicine will depend less on how advanced our tools become and more on how responsibly we use them. Healing begins with honesty, grows through empathy, and endures through fairness. The real measure of progress is not how many lives we can save, but how deeply we choose to value each one.